Hello everyone and welcome back to another anatomy tutorial. This is Dr. Aiyan from the Veterinary Anatomy channel. In this video we will continue dissecting the shoulder girdle muscles of the dog. So let's get started. In the previous video we talked about the origin and insertion of most of the superficial muscles we found in this area here, as we promised in the previous video. In this video we cut most of these muscles to show you the deep layer of the shoulder girdle muscles. So the first one we cut and reflected up and upward is this muscle here. Do you remember the name of this muscle? Is the trapezius muscle. The trapezius muscle with two parts. The cervical part comes from the median ruff to the spine of the scapula, and the thoracic part of the trapezius muscle coming from the spinous processes of the thoracic vertebra to the spine of the scapula. So where exactly, if we put the scapula in place, as you can see, the thoracic part inserts to the proximal part of the spine of the scapula, while the cervical part of the trapezius muscle inserts to the complete spine of the scapula. So we cut this muscle from the spine and reflected upward here. The same we've done actually for the Latissimus dorsi. This is the Latissimus dorsi originating from the thoracolumbar fascia, inserting to the teres major tuberosity, that projection and rough surface on the medial surface of the humerus. Yeah, medial surface, so it will go there. Yeah, for more details about all of this information and function, you need to watch the previous video. Okay, so we cut also this trapezius, the Latissimus dorsi muscle, and we reflected also upward. As you can see, we can see more muscles there. What we've also done, we cut this muscle here. So there is a very long muscle here extending from the humerus up to the head. And that's why we name it humerus region here called the brachium. So we name it as brachiocephalic muscle. Brachiocephalic muscle, and we say that it has three parts. All three parts start with the same word, cleido. So cleidocervical to the neck area, cleidocervical, cleidobrachial to the brachium, inserts to the cranial surface of the humerus. I will put it here for your information. So cleidobrachial inserts here to the cranial surface of the humerus or to the humeral crest. And the third one was a little bit hidden in the previous video. Now we dissected this, and we said the third one called the cleidomastoid muscle. Okay, so we say that all three parts originating from the clavicular insertion, clavicular tendon, this connective tissue found in this area here. Do you remember? The white connective tissue found in this area here. So we dissected and cut these muscles. Now we can see that from the clavicular tendon upward toward the head, we have not one but two muscles. Not one but two muscles here and there. Can you see that? So the superficial one going to the neck is the cleidocervical, while the deep one going there, can you see that one? To the mastoid process called the cleidomastoid muscle. Yeah? Again, we said more information about this in the previous video, guys. Yeah, so this is here the muscle. Brachiocephalic has the cleidobrachialis, cleidocervicalis, and cleidomastoideus muscle. Okay? So we cut this muscle and we reflected down and up. So as you can see here. Now, and before we go deeper, we also mentioned this one partially actually in the previous video, called the Omotransverse muscle, musculus omotransversarius, or Omotransverse muscle. The Omotransverse muscle, if you remember, we say that it originates from the wing of the atlas from the wing of the atlas, and it inserts to the distal end of the scapular spine, exactly this projection, which we all know the name of this projection, the acromion. This is the insertion of the omotransverse muscle. Omotransverse. Let's check if it really comes from the atlas. So if we move this muscle here to the side, I will tell you the name of it later. And this muscle, what was the name of this muscle? Yeah, do you remember? It's the cleidomastoideus muscle. Now we can see the omotransverse muscle coming really from the wing of the atlas. From the wing of the atlas. This is what I'm palpating here, guys, is the wing of the atlas here. So it comes really from there. This is that omotransverse muscle inserting to the acromion. Okay. Just for your information, we say that in front of the scapula, this is the normal location of the scapula, guys. In front of the scapula, or you can say that it's in front of the shoulder joint, just under the omotransverse muscle, you will be able to find a very important and famous lymph node. Actually here, this lymph node, can you see it? Normally it's actually only one, but here we found two. It happens. So this lymph node called the prescapular lymph node, or the scientific anatomical word or name of it is the superficial cervical lymph node. Superficial cervical lymph node, or the prescapular lymph node. Prescapular because it's located just in front of the scapula. Where exactly? Under the omotransverse muscle. Omotransverse muscle. Here we can see how these two lymph nodes are good, like supplied with blood vessels. Yeah. So this is here the superficial cervical lymph node, or the prescapular lymph node. Here is the location of them. They are extremely important, specifically in other animals like bovine or sheep or goat, like where we have to check this here in the slaughterhouse, for example, to see if there's any problem related to this area here. Okay, so we talked about the omotransverse muscle. Now I would like to put these muscles again backward so that we can talk about them a little bit. Yeah, so the muscle we cut in this area here, it's a special muscle we didn't mention in the previous video. So and it doesn't belong directly to the shoulder girdle muscles, but we can see them, see this muscle here. So as I said before, we will talk about the shoulder girdle muscles in this video, but at the same time we will also name some of the muscles we will see on our way. So this muscle here, if you follow it, start from the manubrium sterni, so from the sternum, and moves all the way to the head. From the sternum to the head. What does it mean? It means that we can name this muscle as the sternocephalic muscle. Sternocephalic muscle. In the dog, the sternocephalic muscle has two parts. The first one extend from the manubrium sterni, so the cranial part of the sternum, and inserts to the occipital bone, guys, to the occipital bone. And here we are talking about this muscle here. This muscle here, yeah? So is the sterno-occipital muscle, sterno-occipital muscle. From the sternum to the occipital bone. The other part of the sternocephalic muscle is this one here, which moves from the sternum to the mastoid process of the skull. Sternum to the mastoid process, and that's why we name it sternomastoid muscle. Sternomastoid muscle. Okay? Again, what is the name of this muscle? Is the sternocephalic. Has two parts, the sterno-occipital, to the occipital bone, and sternomastoid, to to the mastoid process. If you want to check, you can follow the sternomastoid and you will see how the sternomastoid inserts exactly in the same location at this muscle. Do you remember the name of this muscle? We just described it before, the cleidomastoid muscle. So both of them, they insert to the mastoid process. Okay, I hope I didn't make it complicated for you, so I'm trying my best to make it easy. Okay, so the cleidomastoid belong to the brachiocephalic. Yeah, the three parts with the cleido starting word. While the sternomastoid belongs to the sternocephalic. So that one is brachiocephalic, this one is sternocephalic. Okay? Okay, back to our topic. I will put just everything in place. Back to our topic. So we cut all of these muscles and moved them to the side to be able to describe some other muscles, like under the trapezius muscle. Under the trapezius muscle there, we can see another muscle, this one here. This muscle here, called the rhomboid muscle. The rhomboid muscle. I will try to move the dog later to show you exactly how it looks, okay? So the rhomboideus muscle in the dog, and specifically in the dog, has three parts. The first part of the rhomboid muscle is this one here. This one here, guys, can you see? Start from the cranial spinous process of, or from the spinous process of the cranial thoracic vertebra and inserts to the medial surface of the dorsal border of the scapula. Here. Exactly this area here. Exactly this area here. So it inserts to the medial surface of the dorsal border of the scapula. Some books, they say that it inserts also partially to the scapular cartilage. To the scapular cartilage. So this is the first part of the rhomboid muscle, the thoracic part. The other part is this one here. Can you see it? I will move this one to the side. So this one here is the cervical part, or cervical rhomboid muscle. It starts from the median ruff there and inserts also to the same area, which is the medial surface of the dorsal border. But of course, it's very clear for you, so the cranial part of it, this area here. While the third part, which we can find only in carnivores, so it's not present. So in other animals, we have the thoracic part and the cervical part. In carnivores, we have one extra head, one extra part, one extra muscle here of the rhomboid muscle, called the capital rhomboid muscle. Capital part or capital rhomboid muscle. From the name, capital comes from the head all the way and inserts also, like the others, to the medial surface of the dorsal border. So here we are talking about the rhomboid muscle. Thoracic part, cervical part, and capital part of the rhomboid muscle. Okay? I may also, like after removing the forelimb completely, I may keep some of these muscles on the trunk so that you can see them. Now, after we talked about the rhomboid muscle, and before we move forward, let me tell you that there is another very important muscle, belongs to the shoulder girdle group, but it's located deeper there. So I can see only part of it, here and there, called the ventral serrated muscle. The ventral serrated muscle. I may cover this muscle later, because if you want to see it, you have to remove the forelimb completely. It's located just under the scapula. But as we can see, part of this muscle, let me just tell you that the ventral serrated muscle has also two parts. The thoracic part, which, as you can see, start from the ribs, rib 1 to 7, from the rib number 1 up to the rib number 7. So it starts from there, or originates from the ribs, and inserts to the medial surface of the scapula. Let me just remind you, so this is the scapula, lateral view, this is the medial view, this is the medial surface of the scapula. If you remember, in the middle here we have the subscapular fossa, but here and there we have a rough surface called the serrated face of the scapula. This is the insertion of the ventral serrate muscle, serrated face. This is the thoracic part of the ventral serrate muscle. Here, cranially, we have the cervical part of the ventral serrate muscle. The cervical part, if you follow it, you will see, and I can palpate, you may be able also to notice that here we have the transverse process of the cervical vertebra. So this will be the origin of the cervical part of the ventral serrate muscle. So the ventral serrate muscle, cervical part, start or originate from the transverse process of the cervical vertebra and moves all the way, inserts medially on the scapula. Where exactly? To the serrated face. So we will have a better view after removing the forelimb. Here, by the way, for the thoracic part of the ventral serrate muscle, I can see the innervation or the nerve here, which we name it normally the long thoracic nerve for the innervation of the ventral serrate muscle. What else can we cover in this video? Yeah, okay, of course, belong also to the shoulder girdle muscles. We have the pectoral muscles. Pectoral muscles, they extend from the sternum to the humerus somehow, but in this view we have the superficial pectoral muscle and the deep pectoral muscle. The superficial is there while the deep is there. So it's better to go in a ventral view to see both parts at once. But again, in this video we can see the deep pectoral muscle. This one here, the deep pectoral muscle, originates from the sternum, inserts to the greater and lesser tubercle of the humerus. Greater and lesser tubercle of the humerus. Do you remember? So this is the greater tubercle of the humerus and this is the lesser tubercle of the humerus. Most of this muscle will go to the lesser tubercle of the humerus there. Okay, well, partially in some books they say that it will, part of it will jump to the greater tubercle too of the humerus, okay? The deep pectoral muscle is innervated by the caudal pectoral nerves, which are part also from the brachial plexus. So what is the name of this one? Is the deep pectoral muscle. Good. Yeah, that's what we can see here related to the topic, but now we can also quickly together name some of the muscles we can see in this view without mentioning maybe origin or insertion, just for your orientation. So that muscle in front of the spine of the scapula, so comes from the supraspinatus fossa, supraspinous fossa, and inserts to the greater tubercle of the humerus called the supraspinatus muscle. Supraspinal, that means we have the infraspinatus muscle coming from the infraspinous fossa here, also to the greater tubercle of the humerus. Where to find this muscle? Is that muscle there. But there, filling the infraspinous fossa. But this muscle, infraspinous fossa, in the dog is also covered with this muscle here. What is the name of this muscle? This is the deltoid muscle. Deltoid muscle. The deltoid muscle has two parts, as you can see. One part comes from the spine of the scapula, so from the scapula, from the spine of the scapula. This is the tendon of it, guys. This is the tendon of the deltoid muscle. It starts from the spine of the scapula, inserts where? To the deltoid tuberosity. To the deltoid tuberosity. And that's why we name it as the scapular part or scapular head of the deltoid muscle. The other one here is the acromial head. Why? Because It originates from the acromion, and inserts also to the same area, deltoid tuberosity. So we will name it as acromial part of the deltoid muscle. So deltoid muscle had scapular part and acromial part. We will dissect and these muscles to show you exactly the location, origin, insertion, innervation, and function in a later video. Okay. What else can we find in this view? We can find. I will keep 1 or 2 questions for you. We can, if we go here, so we have the external oblique abdominal muscle. We have. Yeah. Okay. So let me ask you to write the name of this muscle in the comments. Of course, we describe it in a video which we uploaded long time ago on the dog. So write the exact, always, always please write the exact name of this muscle. Yeah, in the comments, and they will check your answers. What else? So here we have the triceps brachii with the long head and the lateral head. What else? What else? The second question which I'm going to ask you about is, what is the name of this big blood vessel here? This one is the superficial. We described in the previous video. What is the name? Write the name of this. This is a question number 2. The name of this vein, let's say. While in the third question will be, what is the name of that artery here? So the dips there, we have a very big artery. So you need to write, I need you please to write the name of this artery in the comments. This is the question number 3. That's everything for this video. Guys, we will keep dissecting and to show you the deep muscles in this region. Please share this video with your colleagues, and if you have any questions, write them in the comments below. I will try my best to answer your comments. If you have any suggestions, go to the community page and write your suggestion there. So that's everything for today. See you very soon. Bye bye for now.